At C-Point, we want you to be fully consented and fully aware of the treatment procedures that we undertake. There are some clear benefits to what we do, and as with anything in life, there are some downsides. Just as there are risks in crossing the road, there are some risks with implant surgery. With dental implants, some of the risks are from the surgical procedure. These can include bleeding, pain, numbness, swelling, infection, etc. These symptoms can vary from very little to very significant, and approximately 90% of the time they are gone within just a few days. In a very small number of people, approximately 1 in 1,000, pain may continue beyond the first few days and may even become chronic. In those affected, this can vary in intensity from a very low grade ache to something more seriously interfering with comfort and general life and can cause some severe distress. Numbness is a very rare complication and is most commonly found around the area of the lower premolars in cases where there's been a lot of bone loss in the area. Your dentist should be able to tell you how much of a risk it is in your particular case. Dental implants have an excellent success rate compared with other medical procedures. It's important to note, however, that success is not 100% guaranteed. For best results, it's really important that you maintain lifelong health and that the implants are maintained properly. That means seeing your dentist and hygienist trained in implants is essential on a regular basis. Just as you wouldn't expect your car to last forever without regular oil changes, you can't expect dental implants to last forever without regular care. Studies internationally show the success of implants is approximately 82% after 16 years. The most common cause of failure with dental implants is excessive loading. This is usually caused by grinding of the teeth in your sleep, and often you will not be aware of this yourself, which is why it's so important to see the dentist regularly to check for signs. When you're asleep, you can grind excessively on the teeth without realizing it and can put excess stress on the teeth, the gums and the bone. We recommend wearing a night guard every night in cases where tooth grinding is present, and implants are the best solution for missing teeth usually, but they're not as good as the teeth that God gave you. Natural teeth have a ligament around them which acts like a shock absorber and helps prevent the excess wear and excess damage you can get with grinding. Dental implants don't have the same thing. Gum health also has a very big impact around implants. The most common cause of tooth loss in adults is gum disease, and that means you have to look after the gums around your implants just the same way you do around your natural teeth. Excessive forces on dental implants can also cause chipping or even breaking of the crowns around the implants themselves. If they chip, it may require minor or more extensive treatment to replace them or repair them depending on where the break has occurred. In these cases, a night guard must be worn afterwards. Gum recession can also occur over time around implants, just as it can around teeth. Some gum types are more likely to have an issue with this. Thin gums in particular can be very sensitive, and over time the gum may move down the implant, exposing some metal. If this is an area of cosmetic effect, such as the front of the mouth, you may require further treatments in order to correct this. Your individual bone and healing are a major factor in dental implant success. Our dentists have placed thousands of implants and are highly skilled in all different bone conditions. In spite of this, if your bone turns out to be unusually soft or has very poor blood supply and healing may not occur as we first expected. Should your body not heal to the implants, we will typically offer to try again at no cost to you or offer alternative treatment based on your preference. This typically occurs approximately 1 to 2% of the time. So how can you increase your chance of dental implant success? It's important to eat well before surgery and after surgery. When your mouth is sore, it can be hard to get the nutrients that you need for healing. Having smoothies and soups ready can ensure proper vitamins are taken during that healing period. Keeping your mouth particularly clean after surgery and maintaining the stitches well is very important. We recommend a strong antibacterial mouthwash for 2 weeks after surgery until the stitches are dissolved or until the healing is complete. We've spoken about some of the risks and downsides of having dental implants. It's important to also mention some of the major benefits that they can have. Dental implants, in the vast majority of cases, last a long time and look and feel just like your own teeth. They allow all the foods that you love to be back on the menu and give people massive confidence and comfort. They can make people feel younger and generally help preserve the jawbone and the supporting structures of the face, preventing premature aging. The final decision of whether to go ahead is always yours, and we are happy to assist you with alternative treatments or none at all, if that is your wish. Alternative treatments will also have pros and cons. They'll also have benefits and downsides. Doing nothing means the jawbone will likely continue to dissolve away over time. This can lead to facial changes, facial collapse, and premature aging. It can also lead to difficulty wearing dentures, and in some cases, not being able to wear a denture at all. If you do nothing and have some remaining teeth, over time you'll be at a higher risk of tooth loss from decay and gum disease, and from the higher pressure that these teeth are under during chewing. Without treatment, teeth can also move around the mouth, overgrow, and over-erupt. This can cause tooth decay and gum disease. Wearing a denture can also cause some gum loss, gum stripping, and large increases in tooth decay over time. Sometimes numbness can occur. If the jawbone is so badly damaged over time, it can actually cause numbness around the lips. I hope this video has been useful for you and you have a good understanding of the pros and cons of treatment and of no treatment. If you have any questions, please give us a call or email us and we'll be happy to answer them for you.